You find an unresponsive adult who is breathing irregularly with brief gasps. The most accurate assessment is A. Normal breathing, begin recovery position. B. Agonal breathing, begin CPR. C. Airway obstruction, perform abdominal thrusts. D. Heat exhaustion, apply cool cloth. Answer, B. Agonal gasps are not normal breathing and require immediate CPR. During adult CPR, compressions should be delivered. A. At least 80 per minute. B. 100-120/min. C. 130-150/min. D. Less than 90 per minute. Answer, B. High-quality CPR requires a rate of 100 to 120 compressions per minute. A victim collapses in a gym with an implanted defibrillator visible on the chest. AED pads should be placed. A. Directly over the device. B. At least 2.5 centimeters away from the device. C. One pad on the back only. D. Only if the device stops pacing. Answer, B. AED pads must avoid the device by at least 2.5 centimeters to ensure proper shock delivery. A choking adult who becomes unresponsive should receive A. Blind finger sweeps. B. 5 back blows before compressions. C. Immediate CPR starting with compressions. D. Abdominal thrusts while lying down. Answer, C. Unresponsive choking victims require CPR beginning with compressions to attempt dislodging. The correct hand position for two rescuer infant CPR is A. Two-finger technique on sternum. B. Two thumbs encircling hands technique. C. One palm over sternum. D. One thumb only. Answer, B. The two-thumb encircling technique provides deeper, more consistent infant compressions. The first action after finding an unresponsive victim with no breathing but a pulse is A. Begin chest compressions. B. Deliver rescue breaths. C. Apply AED immediately. D. Perform abdominal thrusts. Answer, B. If there is a pulse but no breathing, provide ventilation at 1 breath every 5 to 6 seconds. The ideal chest recoil during compressions allows A. Air entry into lungs. B. Coronary artery refilling. C. Avoidance of rib fractures. D. Increased oxygen saturation. Answer, B. Chest recoil restores coronary perfusion, essential for CPR effectiveness. When using a bag mask device, the most important action is A. Delivering quick, forceful breaths. B. Maintaining an effective mask seal. C. Holding the mask with both thumbs only. D. Ventilating at 20 breaths per minute. Answer, B. Without a proper seal, air entry is inadequate regardless of ventilation technique. A child with a pulse less than 60 per minute and signs of poor perfusion requires A. Only rescue breaths. B. Abdominal thrusts. C. Immediate chest compressions. D. Defibrillation. Answer, C. Bradycardia below 60 with poor perfusion equals cardiac arrest in children. The most common cause of cardiac arrest in children is A. Primary cardiac rhythm failure. B. Hypoxia leading to respiratory failure. C. Stroke. D. Severe dehydration. Answer, B. Pediatric arrests typically begin with respiratory compromise. An AED says no shock advised. The rescuer must A. Repeat rhythm analysis immediately. B. Resume CPR starting with compressions. C. Remove AED pads and reassess. D. Check for pulse for 30 seconds. Answer, B. If no shock is advised, compressions should resume immediately. You witness a child collapse and confirm no pulse. The next step. A. Provide 2 minutes of CPR before calling emergency response. B. Call EMS and get an AED immediately. C. Begin rescue breathing only. D. Do abdominal thrusts. Answer, B. Witnessed collapses require immediate EMS activation and AED retrieval. During infant CPR, compression depth should be A. Half an inch. B. 1 inch. C. 1.5 inches 4 centimeters. D. 2 inches. Answer, C. Infant compressions must reach about 1/3 of chest depth, or 4 centimeters. A victim with a tracheostomy tube requires ventilation by A. Sealing the mouth and nose only. B. Ventilating through the trach opening. C. Delivering breath slowly through the nose. D. Using abdominal thrusts before ventilation. Answer, B. Breaths go directly into the trach opening bypassing the upper airway. When performing high-quality CPR on an adult, interruptions in compressions should be A. No longer than 5 seconds. B. Kept to under 10 seconds. C. 15 seconds during ventilation. D. Avoided for 60 seconds after shock. Answer, B. Minimizing interruptions maximizes perfusion pressure. A choking infant who becomes silent and cyanotic requires A. Finger sweeps immediately. B. Chest thrusts and back slaps. C. Abdominal thrusts. D. CPR only. Answer, B. Infant choking is treated with alternating 5 back slaps and 5 chest thrusts. Rescue breaths for a child with a pulse should be delivered at A. Every 2 to 3 seconds. B. Every 5 to 6 seconds. C. Every 10 seconds. D. Only when oxygen saturation drops. Answer, A. Children require 1 breath every 2 to 3 seconds, 20 to 30 breaths/min. The most reliable sign of effective CPR is A. Chest rise during compressions. B. Visual color improvement. C. AED prompting begins. D. Patient's pulse improves. Answer, D. Return of a palpable pulse indicates effective perfusion. When using an AED on a child under 8 years old, the rescuer should A. Avoid using an AED entirely. B. Use adult pads only. C. Use pediatric pads if available. D. Use the two-thumb technique. Answer, C. Pediatric pads provide reduced energy levels appropriate for children. You suspect opioid overdose and find the victim not breathing but with a pulse. The priority is A. Give naloxone and wait. B. Provide rescue breathing. C. Begin compressions. D. Apply abdominal thrusts. Answer, B. Breathing support is the priority, naloxone is secondary. In an adult, compressions must be performed at a depth of A. 1 inch. B. 1 to 1.5 inches. C. 2 to 2.4 inches. D. Over 3 inches. Answer, C. Correct depth ensures adequate cardiac output without excessive injury risk. A victim with suspected spinal injury requires airway opening using A. Head tilt, chin lift. B. Jaw thrust. C. Cricoid pressure. D. Mask-only ventilation. Answer, B. Jaw thrust protects cervical spine alignment. If a victim has a pulse but is breathing inadequately, ventilation should be delivered for A. 30 seconds only. B. 1 minute, then reassess. C. As long as needed until breathing improves or help arrives. D. Only until AED arrives. Answer, C. Rescue breaths continue until spontaneous breathing resumes or help takes over. When providing CPR to a pregnant woman, you must A. Avoid compressions. B. Place hands higher on sternum. C. Slightly displace uterus to the left. D. Use abdominal thrusts. Answer, C. Left displacement reduces aortocaval compression, improving circulation. The correct ventilation rate for adults during CPR with an advanced airway is A. 6 breaths/min. B. 10 breaths/min. C. 20 breaths/min. D. 30 breaths/min. Answer, B. Continuous compressions with 1 breath every 6 seconds equals 10 breaths/min. A child with a foreign body obstruction is coughing strongly. The rescuer should A. Perform abdominal thrusts. B. Deliver back blows immediately. C. Encourage coughing. D. Begin CPR. Answer, C. Effective coughing is the safest and most effective airway clearance. During CPR, a sudden rise in EtCO2 may indicate A. Improved airway obstruction. B. ROSC. C. Hyperventilation. D. Dehydration. Answer, B. EtCO2 jump suggests return of circulation. A victim in water requires AED use only after A. Drying the chest. B. Removing wet clothing completely. C. Waiting 10 minutes. D. Raising body temperature. Answer, A. AED pads must contact dry skin for electrical conduction. For a choking pregnant woman, A. Chest thrusts are preferred. B. Abdominal thrusts are preferred. C. Back blows only. D. Begin CPR immediately. Answer, A. Abdominal thrusts risk injury, chest thrusts are safer. You see a bystander delivering very shallow compressions. The best correction is A. Increase depth to 1/3 chest size. B. Increase depth to at least 2 inches. C. Deliver breaths only. D. Slow compressions. Answer, B. Adult compressions must reach 2 to 2.4 inches. The purpose of defibrillation is to A. Restart a stopped heart. B. Stop all electrical activity. C. End fibrillation allowing normal rhythm to resume. D. Increase oxygen levels. Answer, C. Shocking stops chaotic impulses so the heart's pacemaker can reset. When using a bag mask with 2 rescuers, the second rescuer A. Performs compressions only. B. Squeezes the bag for ventilation. C. Holds mask with both hands. D. Monitors pulse only. Answer, C. One rescuer maintains a seal while the other ventilates. An unresponsive infant with no pulse should receive CPR at a ratio of A. 30:2 for all rescuers. B. 15:2 for 2 rescuers. C. 10:1 for all cases. D. 20:2 single rescuer. Answer, B. 2 rescuer infant CPR uses 15:2 for improved oxygenation. A victim with a healthcare bracelet reading DNR collapses in public. BLS rescuers should A. Not begin CPR. B. Start CPR unless documentation is verified. C. Call family before acting. D. Wait for EMS to confirm. Answer, B. CPR begins unless an official DNR order is physically present and validated. If AED pads overlap on an infant's chest due to small size, the correct placement is A. Both pads on the back. B. 1 pad on chest, 1 on back. C. Both pads side by side. D. 1 pad on neck. Answer, B. Anterior-posterior placement prevents pad overlap. You deliver a shock and immediately notice the AED is still analyzing. You should A. Wait for AED commands. B. Restart compressions immediately. C. Remove pads. D. Turn off AED. Answer, B. CPR resumes instantly after shock without delay. A victim with suspected opioid overdose is breathing slowly but has a pulse. You should A. Give naloxone but no breaths. B. Start compressions. C. Provide rescue breaths and give naloxone. D. Do nothing until breathing stops. Answer, C. Breathing support plus naloxone is optimal in opioid toxicity. A choking adult refuses help and continues coughing forcefully. You must A. Perform abdominal thrusts anyway. B. Call EMS immediately. C. Stay with the person and encourage coughing. D. Hit back firmly. Answer, C. As long as cough is effective, no physical intervention is needed. When providing mouth-to-mask ventilation, the rescuer should A. Deliver fast breaths. B. Maintain head tilt, chin lift. C. Ventilate every 3 seconds for adults. D. Hold the mask loosely. Answer, B. Airway must remain open to allow effective breath delivery. If an AED malfunctions during resuscitation, the correct action is A. Stop CPR until a second AED arrives. B. Continue CPR and send someone to retrieve another AED. C. Give blind finger sweeps. D. Begin ventilations only. Answer, B. CPR continues non-stop while another AED is obtained.